Hi, good morning, everyone. I'm going to be talking through the report on the coordination side of vaccines, and I'm fortunate today that when we get to Q&A, several of the other commission members are available as well to take questions on the complexity of this issue and hopefully provide some clarity. So if we come to the next slide, our commission was made up of people from around the world with very extensive expertise from economics to infectious disease control to legal expertise to actually operational, as well as those who've had very close ties with industry to understand the various dimensions. And a big thank you to the National Academy staff. We had Janelle Winter as the study director, as well as a very strong team supporting, which helped us pull together this report in quite a short amount of time while we are living through the COVID-19 crisis and trying to look ahead and learn at the same time. So I'm going to talk through now what our remit was of what we were going to cover when what we were asked for by OGA. So if we come to the next slide, the statement of task was to look at the global coordination on vaccines for the next pandemic threat. Let's come to the next slide. So the first thing was to look at what do we have already in place for seasonal and pandemic influenza vaccine development, manufacturing, and distribution. Much of this was developed in response to H1N1, but trying to say what is already there. So we don't want to replicate what works already and what isn't working. What are the gaps? The second part was looking at COVID-19 and saying, well, there are lots of new things that have been developed, the ACTS accelerator, COVAX, also those in relation to outbreaks like Ebola. And so what has worked for these situations that we could perhaps learn for future influenza pandemics? And so looking ahead at some of the innovations in the business models, the distribution to say what has worked and not worked as we've lived through this COVID-19 pandemic. We come to the next slide. The third was actually to provide practical and feasible recommendations to say, okay, now how do we move forward in the months and the years ahead to make sure that we can do better next time, and on all areas from looking at the coordination side to research, manufacturing, as well as equity, distribution, and access, which we know has been a problem through the COVID-19 pandemic. The fourth part was looking at the business model. We know that it's very difficult to create incentives for this kind of work. That was the thinking behind CEPI, behind COVAX. So how do we actually start to incentivize this kind of work in manufacturing and distribution when we don't know when the next pandemic will be? How do we actually get investment into an area where it's unpredictable what the return will be for businesses? And if we come to the next slide, the final task was to provide recommendations on specific financing strategies and mechanisms, such as looking at risk pooling, trust funds, what kind of incentives there could be that could be sustainable in the months and the years to come. And hopefully this will encourage national investment as well, which is the flip side of just looking at the international picture. So huge remit. We looked at it over several meetings, a lot of discussion, and I'm going to now turn to kind of some of the context of where we got to. So if we come to the next slide, some of our deliberations on the Influenza Imperative. So next slide. So the current pandemic influenza capacities we looked at. So the supply side is that the 2019 global capacity for producing pandemic influenza vaccines is approximately 6.4 million doses in 2019 over 12 months. About 79% of that is based on egg-based systems. And we have a PIP framework, and others on the commission are quite expert in this, where industrial partners have committed to providing 400 million doses to low and middle income countries. Because as we've learned through COVID-19, having the doses is one thing, having them distributed to low and middle income countries is another question itself. On the demand side, we know that even though in the UK and the US, there's quite advanced seasonal influenza programs, that most countries don't have these kind of vaccination plans and programs for adults and have not made seasonal influenza vaccination a priority, which means there's not really ongoing platforms that you can build off of in these countries to then put on top pandemic flu distribution. It still needs to be built in the months and the years to come. So we come to the next slide. So the partnerships for influenza vaccine platform technologies you can see here are distributed, but what's astonishing to see is there's very little being done across sub-Saharan Africa, across the entire African continent and Latin America. And so one of the things our committee deliberated upon was, is it fine to have several hubs if they have comparative advantage and then hope they can distribute to the rest of the world? Or is it better to actually create these platform technologies and partnerships in a geographically distributed way? And I'll come to that when we get to recommendations. If we come to the next slide. So we had 4 questions guiding the report's deliberations and recommendations. The report is now public, so hopefully you'll have a chance to look through it if you haven't already. And I'm going to go through each of the chapters and what we tried to look at each of them. And really this is going from the remit we were given and kind of looking forward. So first, chapter 2, we looked at the global governance landscape. So what existing structures are there? So this is useful to understand where are we today and what are the gaps that we have seen exposed. The second is we know that we need to get pathogen information, genetic sequencing shared incredibly quickly if we want to get to diagnostics, to therapeutics, and to making vaccines. So we need to think about how do we make this faster? How do we get any part of the world willing to share samples? And if they're going to share them, what are the benefits those countries will feel for sharing them with other partners in the world? The next is strengthening global partnerships for vaccine manufacturing and technology. So once we have those, how do we actually promote tech transfer, actually get the manufacturing and scale up production? So you can think of this as kind of a sequence from, cycle from getting the sequencing to actually getting the manufacturing technology done to at the end of it, and this is chapter 5, what are the financial incentives to promote scale up and equitable global access, and how much do these need to be customized for influenza, and how much could these be generically for pandemic preparedness? So we kind of try to take you through from start to finish of how you would have to move quickly to get vaccines made from the pathogens being shared to distributed and financed for all parts of the world. So we come to the next. Yes. So what do you actually need in terms of requirements for a pandemic preparedness and response system? And so again, you need from the start surveillance to detect something has occurred. Then that pathogen has to be shared. You need the technologies ready to go, whether it's mRNA or egg-based, ready to make the vaccines. Then you have to manufacture them. You have to look at IP if you're looking at, is this going to be, are we going to have emergency IP transfers? Is it better actually to work with existing companies if they can manufacture enough? Regulatory issues, and finally delivery onto the ground. And one of the things we also debated was how much we want to integrate influenza into the broader pandemic preparedness agenda, but also how much is influenza unique or exceptional. And so this was something we debated, and you can see here that with influenza, we have well-established existing networks and legal arrangements. We know there's unpredictability of where the next spillover event will happen and when. We know that this is going to probably come from animals through zoonosis, and so we need to kind of continually monitor those. That we have limited global use of antiviral therapeutics and diagnostics, which means vaccines become incredibly important tools. And we know there's a long historical pattern of pandemics. And so the next one is likely around the corner and not a if, but a when. So if we come to the next slide. And so the key arguments we're here for. The first is that scale up is required to overcome vaccine hesitancy during a future pandemic. And we know that we need a strong access and benefit sharing system, but in acute scarcity, as we've seen with COVID-19, it's not going to really address equity. Rich countries will take the vaccines that they think that are needed, even now taking boosters. And so it's good to have the system, but we have to understand how it starts to break down in crises. The second is that innovations are coming in terms of influenza vaccines. Platform recombinant technologies offer the potential for increased efficiency, efficacy, and faster production. A universal flu vaccine, which we'll talk to, would be a game changer, having that ready to go. But here, discussing egg-based technologies versus mRNA, how much do we move and mix different kinds of innovations? The third is the business case for influenza has been heavily focused on seasonal vaccines because then there's seasonal demand. But we need to look at actually pandemic flu would require a surge. And so the market for seasonal influenza is not going to meet that demand. So how do we think about the business case for a much larger market than the seasonal flu one? And finally, going back to that graph, the figure that was showed, the regional manufacturing does not offer a full solution for vaccine equity issues. Because we don't want this to succumb and end up with vaccine nationalism. So yes, we need to have geographically distributed hubs, but it shouldn't be that every country just takes care of its own, because we've seen that that's not the full solution, and we end up being more isolationist, and we should actually be more cooperative. So we have to find a balance between those two ends of the spectrum. If we come to the next slide, so coming to the recommendations of where our group got to. So next slide. So in terms of who are we trying to recommend these to, obviously we need an audience. The idea here is that there will be appetite from the G20, the G7 to do more in pandemic preparedness and readiness, either through a new governance mechanism or a new instrument. We've heard about new treaties being proposed, but we're not proposing exactly how this should look. we're not saying this is exactly what the agency or treaty or body or whatever it is could look like. We're just offering recommendations on how the gaps and how they could be filled. And other parties, industry, civil society organizations are just as vital as actual governments in trying to move these forward. So if we come to the next slide, so recommendation first. The WHO, this one is targeted at member states who can look to the WHO to develop an integrated agenda to strengthen preparedness and response for all respiratory pathogens of pandemic potential. And this needs to move from the surveillance from the start to the information sharing about the sequencing being shared quickly, to the development, manufacturing, and deployment of vaccines. Instead of each of these being seen in a silo, meaning that we're only talking about surveillance here and we're only talking about pathogen sharing here and then manufacturing over there, it needs to actually be an integrated agenda where we see that as a full system of how we prepare from the start to the finish. So an overarching agenda, and this should be one that of course encompasses pandemic influenza, but should be focused on all respiratory pathogens. So for example, COVID-19 would have been included in this, given again, many of the characteristics of pandemic influenza would be shared across other respiratory pathogens. So come to the next. Recommendation 2, we know that surveillance systems are quite weak in several countries and regions, which means it could be quite a while before a new pathogen would be picked up and we'd be able to actually get the sequencing out and be able to start working towards a vaccine. So the weakest part of the system is probably right at the start, the surveillance systems to actually pick this up. And we need to increase the investments there to understand how to have sustainable financing for modern, timely surveillance, specifically for respiratory pathogens, which could quickly become spread across the world and into a pandemic. So it comes to the next recommendation. So the World Health Assembly should explicitly clarify that the PIP framework does cover genetic sequence data. We can discuss this in the Q&A, but there was some discussion over how much is genetic sequence data actually covered in terms of sharing. And this needs, the PIP framework has been developed to balance the need to share data, share sequencing with actual getting access to the products, the vaccines, and make sure countries don't feel like they're left behind if they share and then don't feel like they get the benefit of sharing. And so the idea is to build off this framework to cover a broader range of pathogens and their genetic sequence data. So we have something that seems to work reasonably well. How do we take that further? So we come to the next recommendation. 4 is, this is about how to support R&D for influenza platform technologies, that we need to extend the mandates of bodies that have been created, CEPI and others, to actually look at influenza and other respiratory viruses and looking at their industry partners' platforms and saying, how can we structure these to look at whatever new respiratory pathogen might be on the horizon? So if we come to the next one. Recommendation 5 is about what we might call a moonshot program, which saying what would be ultimate would be to have a universal influenza vaccine, which but we need to incentivize the development of this, the licensing, the procurement, and this requires push elements as well as pull elements to make sure that this could actually happen. And it could be coupled with a parallel effort for coronaviruses. We know there's efforts for a pan-coronavirus vaccine, but basically to get ahead of it, to already start developing these technologies that could cover a wider range of pathogens rather than thinking that for every single pathogen that comes along, we have to develop a specific vaccine for it. And so starting to think about the kind of new technologies and how we actually kind of try to get a moonshot, take a jump to where we are right now. Next slide. And here comes back to the distribution of this, that we need to think carefully about hubs. As we've seen, parts of Africa are asking, saying they want to have factories on the continent. They don't want to be reliant on other parts of the world. And so how can we start to have a multilateral partnership to track emerging technologies that could be where we focus on tech transfer for influenza, promote partnerships with geographically distributed hubs, and provide technical training ahead of time? Because we know one of the issues with COVID-19 is that there's also the issue of actually not just the factories, but the technical training and the human capacity elements of having people who can run the factories and get them to scale to be able to produce at quality. Next slide. And recommendation 7 is looking at giving funding explicitly for introducing and deploying next generation seasonal influenza vaccines. So not to forget the ongoing challenge each year of the thousands of people who die from flu, and that the WHO regional offices could work with countries to do more extensive assessments of their readiness of how they could actually start to develop seasonal influenza programs for adults and high-risk groups in the next 1 to 2 years. And so again, would build up the existing programs that could be then built upon if there was a pandemic flu incident. So if we come to the next slide. So I will stop there. Thank you very much for that, and happy to take any questions and answers alongside the other commission members who are on this call. Thank you.